What do you think about diet? Can dietary changes help in the hair loss, or are there some food materials or things like that which are helpful in hair loss?
Definitely. If you are deficient in them, it can lead to significant hair loss.
So, Dr. Preeti, which patients come and ask is, can stress cause hair loss? And if so, is there a way to cut down that stress and sort of a remedy for this stress-induced hair loss?
So yes.
This has to be a mental stress or a physical stress, or both that kind of stress can cause hair loss. So today we are going to talk about hair loss treatments, a very comprehensive video where we're going to touch upon a lot of aspects of this very important topic, from which a huge number of patients are suffering, a huge number of population is suffering. That is your ongoing hair loss. Rather than going for a surgery or other things like that, we initially always want to treat our hair loss by medical treatments, dietary advices and things like that. And for that we have Dr. Preeti Saraswat here, and in this she is going to be talking about the various hair loss problems, treatments, and the efficacy of these treatments. And she, as you know, she's a diplomat of American Board of Hair Restoration Surgery and has been in this field for almost a decade now and has treated a lot of patients of hair loss. So welcome you to this episode of hair loss treatment. So Dr. Preeti, very routine questions which patients come and ask is, can stress cause hair loss? And if so, is there a way to cut down that stress and sort of a remedy for this stress induced hair loss? So we would like you to speak about that in brief.
So yes, stress can cause hair loss. So previously it was limited to few people. Like if I am under stress and I had a hair loss, probably I would ask my doctor and then I would know that yes, it caused hair loss to me. But we saw a large population suffering from hair loss post COVID. COVID happened to almost every one of us.
Yes.
And then after COVID, we saw a huge turnout of patients with significant hair loss. So everybody knew that my hair loss is due to COVID. But this stress, whether it is due to any reason whatsoever, can cause significant hair loss.
This has to be a mental stress or a physical stress, or both that kind of stress can cause hair loss.
So yes, see, both mental and physical stress, what they do to our body, they secrete stress hormones from our adrenal glands, which are cortisol and corticosterone.
Right.
So these stress hormones, what they do further, they prevent secretion of certain substance, which is GAS6, to be secreted from the dermal papilla of hair roots.
The root, yeah.
So hair के root में से अगर कुछ सब्सटेंस जो हेयर को ग्रो करे वो ही ख़त्म हो जाता है और बहुत डिक्रीज हो जाता है. तो स्ट्रेस डायरेक्टली इस टाइप का हेयर लॉस कॉज कर सकता है. एंड दिस डज नॉट हैपन ओवरनाइट लाइक टुडे आई एम स्ट्रेस्ड एंड आई विल स्टार्ट हैविंग हेयर लॉस फ्रॉम टुमारो. नो, this kind of a hair loss will start happening between 2 to 6 months of my triggering factor. So this is so common with all the ladies will agree with me post delivery.
Yes.
So any kind of mental stress, physical stress, somebody underwent a surgery, somebody was very much ill, or they had some mental problem, anything whatsoever, they may land up in telogen effluvium. So this is telogen effluvium, which will happen 2 to 6 months of time difference.
And what are the remedies, like in short, if you can talk about the remedies for this?
So yes, for the remedies, just I'll take one more minute to tell you that apart from telogen effluvium, this stress can lead to other problems also, like somebody, when they are stressed, they will not eat properly. So the patient may land up in nutritional and hormonal imbalance. Then again, their autoimmune system may be somewhat disrupted. So it could be a triggering factor for alopecia areata, which is like coin-shaped patches. And one more thing is that somebody is so stressed that they start plucking their own hair. So that is trichotillomania. So this all can happen. Yes. Now for remedies, right? So in order to gain hair back again, we should cut down the stress factors. So if I try to keep myself calm, so people can meditate, they can start exercising, they can talk to friends, they can start living a normal life, eating proper food, then they may cope up with the hair loss within 6 months to an year of time. Along with that, they may seek medical help to improve the hair loss.
Okay, so that's very helpful. And what do you think about diet? Can dietary changes help in the hair loss, or are there some food materials or things like that which are helpful in hair loss?
Definitely, diet plays a very important role in good hair. So there are so many vitamins and minerals now which we know if you are deficient in them, it can lead to significant hair loss. So eating proper balanced diet, like our Indian diet, हमारा प्रॉपर थाली वाला खाना, dal, sabzi, curd, rice, chapati, along with fruits and a glass of milk or chas. So whatever we traditionally eat in our home is good for healthy hair and healthy skin. But if somebody has undergone hair loss problem due to stress or any reason whatsoever, then they can always improve in their diet in taking good quantity of green leafy vegetables, then legumes and lentils, then dry fruits like walnuts, pistachios and almonds especially, and then they can consume fresh fruits and little curd or yogurt. So rich protein diet along with good vitamins and minerals. So they should refrain from fast food, from food which is very rich in calorie but very deficient in nutrients and micro and macro elements which are very essential for hair growth.
And packed foods?
So we all know packed foods are they are ready to eat kind of foods, so they have a lot of preservatives which are not good for health. They are bad for your intestinal inner lining and metabolism, and they are not rich in micro elements and vitamins. So you can consume a lot of it, you can gain calories from it, but you will not gain good vitamins and minerals which you require for normal day-to-day living.
Now, a very, very important topic, and many patients come and ask that if they have lost some hairs, can they regrow the hairs? Can they do something at home? What we commonly say as DIY, do it yourself, any such kind of treatments. But before we talk about those DIY kind of things, we would like you to click on the link given above on the playlist of 4 to 5 videos where you can find out your grade of baldness, because we all know that there are 7 grades of male pattern baldness, Norwood grades, and to know where you fall and what kind of treatments you should be looking out for your stage of hair loss, where Dr. Preeti has talked about the stages and its treatment in detail. So if you are in that stage, you want to look out for that, please click on the link above. Now coming to the commonly asked question, what can we do? Patient asks, what can we do to regrow the hairs naturally at our home? So please elaborate on that.
It is one of the most common questions
Yeah.
asked when somebody comes to you. So what I want to emphasize it that in your own homes, before you actually start taking any medication, you can always look for a few points, like you can cleanse and nourish your hair properly without much of chemicals. So you can make some home shampoos and a proper cleansing by traditional Rita Amla Shikakai shampoo, which you can make yourself
We
at
have
home.
made a video on that,
Yes,
detailed
we
video
have-
how you can make it at home. Yeah.
Yes, we have. So these kind of natural shampoos and conditioners also. So there are things available like chemically we can say hydrolysates of wheat and rice, but then rice water and other things are available at home also. After proper cleansing and conditioning at home, we can take care of good nourishment, food, and also normal day-to-day lifestyle. So we all know a healthy body with a good metabolism reflects your good skin and hair. So good nutrition, as we just now talked about, and a healthy lifestyle can always help you in your DIY things. And also just for a quick review, you can have some homemade hair packs at home, like henna and avla, or you can have aloe vera gel along with coconut oil and things like that. So they really help.
So now coming to the next point, we have some patients, young patients, coming with a small amount of hair loss and very concerned about it. So it's a very common question, and I think we should share some points about this, also some knowledge about this. How much of hair loss is normal? Because we know that there's some shedding and the hair cycle and all that. So please talk about how much hair loss is considered to be normal.
So see, hair is not a constant thing. It's a live tissue which has a hair cycle. So hair is very small, dormant at one point of time. Then it comes in anagen phase, it growing phase. After it has attained its proper growth and suppose 2 to 6 years of age in the scalp, then it comes to resting phase, and then catagen phase, and then exogen phase. It means, what I mean to say is that hair is constantly growing in phases.
Yeah.
So that ways a few number of hairs should actually fall off for new hairs to come up.
Otherwise, we will have a very long hair.
Yeah, so we do not have doll hair. So it's like something is stuck, chipak gaya, and then it is stuck to it. Aisa nahi hai. So they keep on growing. So 50 to 100, up to 150 of hairs, if somebody sheds in one day, it is considered to be normal, provided the equal number of hairs keep on growing. So they will lose hair, but then you won't find much of decrease in volume or thinning of hair on the scalp or show of scalp, because you're constantly growing hair also. But if the number exceeds excessively, like you have hair falling everywhere, on the pillow, in the shower, in the comb, in the brush, then probably you see thinning in the hair, and it means you are losing hair more than you are growing. So then it becomes pathological.
Great, thanks a lot. And now coming to the treatments, what are the most effective hair loss treatment for men and women? So if you would like to talk about it separately, like for men or for women.
Yes, so for medical treatments for hair loss in men and women, by hair loss, I think we mean male and female pattern hair loss, because these are the commonest causes of hair loss in men and women. So US FDA has approved minoxidil for females, topical minoxidil to be applied on the scalp as a remedy for female pattern hair loss, and minoxidil and oral finasteride tablets for males for male pattern hair loss. These are the US FDA approved drugs. Apart from that, as we just now talked about various nutrients and other vitamins and minerals which are required, now there have been studies that different minerals and vitamins, if we lack them, then also there can be male and female pattern hair loss seen. So this triggers the DHT problem. That way we should actually give the vitamins and minerals tablets which are very specific for hair. So those should be given. Along with that, good lifestyles should be followed. And then there are therapies. There are various therapies which can be suggested to the patient along with the medical therapy. So these are the platelet-rich plasma therapy, the mesotherapy, now dutasteride therapy, and low-level laser therapy along with derma rollers or derma stamping or derma pen. So all this can be combined together as per your consultant or your doctor, whoever you are going to, and then you can chalk out a plan for yourself.
Yeah. So we have a long list of videos we have made about men and women hair loss and the treatment, and you can watch those videos in the link given above to know more about the treatment specifically for men and for women. And one very funny question which people come and ask us is that, can they trim or razor shave the hairs and then the next time they'll have a decreased hair fall and the hairs will grow out better? Is there some truth to this myth, or is it just a myth?
So this is such a common thing. People say that, doctor, I shaved my head so that I now will grow new hair. So what happens is, when you shave your head, you actually shave all of it. So you shave those hairs also which are already going. So they are in the vellus stage.
Yeah.
So we know that hair are of three types. One is terminal, which is more than 0.06 millimeter. In between is intermediate 0.06 to 0.03. Then और नीचे आइए 0.03 से कम बहुत पतले downy hairs, brownish, which are bound to fall. आप कितना भी medication दे दो. So these hairs, downy hairs, vellus hairs, at least they were there when you were not shaving. But when you shaved them, they will not grow back. So what happens if you are suffering from hair loss and you are having vellus hairs and you shave your head, you will not grow back the downy hairs and you will face thinning of hairs. So on the contrary, you will have thin hairs than what you had before. So this is a myth.
Also, we don't see the small hairs falling, so this gives us a less amount of strength.
Yes.
Okay, so just to talk about the vitamins and supplements, what other important vitamins and supplements which we should prescribe or our patient should take it if they are having a hair loss?
So post-COVID, vitamin D3 deficiency is seen to be very, very common, and it is a leading cause of hair loss in both males and females. Apart from that, we require vitamin B complex and B12 for good hair. Then we need iron. Along with iron, we need folate and zinc.
Yeah.
And along with that, we all know we need biotin. So
these are the important supplements and
just
vitamins.
To enumerate.
Now coming to another important aspect about hair loss, which is hair transplant. How effective is hair transplant as a hair loss treatment?
So we all need to understand, I think here is, for the existing hair, you need medical treatment, medical therapies to look after your hair, cleans properly, DIY and everything. But the places on your scalp where you have lost hair, you cannot regrow them apart from a procedure called hair transplant. So hair transplant is absolutely essential for the balding areas, starting from Norwood 2 to 3 to the whole of it, as we all know.
It's quite effective.
It is very effective.
Last question, how long do these hair transplanted hairs last? How long does a hair transplant last for, the transplanted hairs?
So the life of hair which will be transplanted in the front actually depends upon the life of hair which is there at the back. So the donor area, वहाँ पर hair जितने साल रहेंगे, same life will be carried out in the front where we transplant the hairs. So the life of hairs will be approximately just equal to the life of hairs which are at the back. So जितना पीछे रहेंगे उतने ही साल आगे.
The quality also.
Yes.
Provided it has been done in a proper way without.
Of course, without exceeding the safe donor area.
We request you to subscribe to our channel and keep your notifications on so that you can know more about hair transplant, hair loss and all such important useful informations. If you want to know how to find out the right center for hair transplant, how to choose your hair transplant clinic or a doctor, please click the video on the right. Thank you very much.